What are the complications of mesh in hernia repair surgery?
Hi guys, I'm Dr. Iraniha from Surgical Oasis Institute. Today I want to talk to you about the potential of complications related to the placement of the mesh. So mesh placement is very critical in some of the hernia repair or pelvic floor repair. So we need to discuss the potential problems with the mesh with the patient in detail. So one of the complications that can happen is called seroma. Seroma is an abnormal tissue fluid that accumulates in the area of the repair because of the placement of the mesh that create an exaggerated scar tissue formation, and that fluid can stay there and create a bulge, most of the time temporarily, but sometimes even permanent, that require extra procedure by aspirating or sucking out that fluid collection multiple times in order to treat that problem. The other issue with the mesh is the infection. The risk of infection is extremely low, but that's why as an experienced surgeon that does work with the implant and place mesh implant all the time for hernia repair, we go through a very detailed ritual for decreasing the possibility of mesh placement. So that actually separates a very experienced surgeon with the rookies in order to decrease the possibility of an infection. The other issue with the repair of hernia with mesh is a recurrence. Obviously, is not necessarily related to the actual mesh. This problem is mostly related to inappropriate placement of the mesh, or not putting it in a right place, or not using a right mesh for the patients. So as an experienced surgeon, we customize this based on the patient's body habitus and the size of the hernia and the location of the hernia, and we come up with the final plan to place an appropriate mesh for those type of patients to decrease the recurrence of the hernia. Chronic pain is another issue with placement of the mesh. Most of the time it happens because the mesh creates an exaggerated scar tissue formation, and sometimes these scar tissue go around the nerve besides the mesh and create damage to the nerves and create chronic pain. So again, an experienced surgeon try to use the location that has less possibility of nerve damage or sensation of the mesh after the surgery. Very rare problem of the mesh, especially the mesh that are attached into the abdominal wall internally. It could be creating a scar tissue formation or adhesion between the loops of the small intestine that can cause many trouble, including bowel obstruction or blockage, fistula formation, which is abnormal track between the bowel and the skin, and they create major trouble. Those problems are extremely rare, and again it goes back to the how surgeon and how experienced they are to place the mesh appropriately to prevent that problem. For more information about mesh and possibility and potential of complications, please contact my office at 949-646-8444, or go to my YouTube channel at Surgical Oasis Institute for looking at my surgical repair videos, or even going through the longer discussions about the hernia repair that I have on